Hi, it's Doug from Rise Above Performance Training. Today I'm here with special guest Jeff Lamb, Move Well Physical Therapy in San Francisco. Jeff's my go-to guy for physical therapy. He's a little bit more on the progressive side of things in terms of athletic performance and also rehabilitation. Today he's going to help us out, talk a little bit about Kinesio Taping, and he's actually going to do a demonstration for you guys on an ankle sprain and how to tape it. I'm sure Jeff can tell you a little bit more about it, but in terms of taping, it's not like a quick fix. It's more or less like a tool to help you keep doing what you're doing in terms of performance, but also to kind of make sure you don't injure yourself any further. So what are your thoughts on the taping, Jeff, and kind of why you use it within your practice and other forms of modalities with physical therapy?
Right. Well, Kinesio Tape is the first brand of tape that came out. There's a few on the market right now. Rock Tape is one that is commonly mentioned alongside Kinesio Tape. What I use Kinesio Tape for mainly is as a corrective measure to help facilitate movement or to inhibit tight muscles. Not necessarily make an athlete perform better or make them, superhuman. After all, it is just tape. What's great about Kinesio Tape is there's a bit of flexibility in its material, and if you can see, you can stretch it, say what they consider 100%, 50%, or 10 to 20%. And depending on the type of technique, the amount of stretch facilitates or inhibits what we want to do with a specific joint. And in this case, we're going to deal with the ankle joint, and we're going to approach this as if our subject here has had an ankle sprain medially. So there's actually 3 or 4 techniques that I can apply to the ankle itself, but we're going to pick out 2 of the techniques. The first one being a technique to inhibit the posterior tibialis and cause it to strengthen medially so that there's a little bit more support. The second technique is called a metatarsal arch technique, where I'll start at the 5th metatarsal and pull across and help further support the medial side of the ankle. The main anatomic structure being the deltoid ligament medially. So we'll start taping.
Okay. So what you're talking about, so her muscles are weak on the inside of the foot here. Is that what you're saying? And causing her to roll the ankle this way. Is that correct?
First off, we're looking at medial ankle and lateral ankle.
Okay.
And a typical eversion sprain of the medial ankle region involves eversion, or the bottom of the foot pointing outward, rolling inward. So this medial arch, or the inside arch, drops. So what I'm going to do is help facilitate the posterior tibialis group of muscles using Kinesio Tape by starting proximally or closer to the heart.
Okay. And
placing them in a bit of inversion, plantar flexion, putting a little bit of stretch. Textbook wise, it's 50%. Putting the anchor here, so when we bring her back to neutral or freeing up my hands, the tape will help support or facilitate that muscle to work a little bit more than it would without the tape. And then the second technique is more or less a structural support.
Okay, great. So let's let Jeff get ready, and we're going to tape this ankle.
Okay, so basically I've created 2 strips. I cut the Kinesio Tape in half. A second method is by means of a Y strip, where I cut it partially and leave a little bit more tape to fill in the bottom portion. But I've chosen to use 2 individual I strips as opposed to Y strips. So let's have our subject here plantar flex and invert.
So she's going to flex her foot down and turn her toes inward.
Correct.
Okay.
And what I'm going to do here is I'm going to put an anchor at the top.
Okay. So you go right along that muscle, right in the muscle belly there mostly?
Yeah, right below the gastrocnemius.
Okay, so right where the tibialis is.
peel this tape off slowly. So we're providing an anchor, and what that means is I'm just basically sticking tape onto the skin, activating it by means of rubbing it. And what that does is it creates a little heat, makes it a little bit more sticky. And this is where, what I mentioned, the range of stretch. This is the therapeutic zone, as the Kinesio tape experts would call it. And I'm going to put 50%.
Okay, so about half the stretch.
Yeah.
Now, would you do differently depending on the grade of ankle sprain, or the type of person?
That's a good question. Textbook. There's basically a textbook formula for each of these techniques.
Okay.
So for this technique, it's 50%, no matter who the individual is, how big they are, how small they are, how athletic they are. But as a clinician, I've managed to sort of modify my own ways of doing things depending on experience and whatnot.
Okay.
So, if I felt like it was needed to go up to 75%, I would do so.
Okay. Based on the individual.
Yeah.
Okay.
So again, like as in your training, everybody who walks in gets more or less an individual sort of template. It's not, as I think you mentioned in the past, a cookie cutter workout, right? So this is,
and that's what we like. I mean, I've been to too many physical therapists that have just done the same thing for everybody and not taken into consideration their injuries and their physical ability. And people are going to heal at different rates too.
Yeah.
And tolerate pain differently too, correct?
Yeah. There's quite a distinct relationship between training and injuries and rehabilitation, and one doesn't work well without the other, and it helps that I'm also a trainer, but mainly I work as a physical therapist. So we've got the first strip on.
Okay. So it looks like you put on the posterior tib and then you crossed just under the calcaneus here?
Yeah, just behind.
Behind, okay.
And then the medial is, and then just kind of,
and wrapped along the fascia there across the.
Yeah.
Okay.
So again, this is the anchor. There's another anchor there.
Okay.
Going from proximal to distal, which means from top down in this instance.
Great. And
I've wrapped it behind the posterior tibialis, the anatomy that we're trying to address here. So the other tape will go in front. Okay. So we're pretty much embodying that piece of anatomy by going through the front. And if you can see through here, I can sort of contour this tape. That's the other great thing that separates this from just traditional athletic tape, is you can
it doesn't have to be straight, or it won't kink up.
Yeah.
Oh, that's nice.
And provide the last anchor. And what I've done here is I've pre-cut it, but I've even honestly made a mistake, and it's a little bit too long, but we can adjust on the fly, which I won't necessarily do for sake of time, but it was a little too high, and what I could have done was just cut that piece and shorten it out. But for the sake of time, I've just applied it, and it's just going across the plantar fascia a little bit more. So this is the first technique, again, to facilitate the posterior tibialis based on the nature of the injury. It's been traumatized, it may or less been inhibited, it's weaker, so we want to facilitate it, we want it to make it work.
Okay.
So I've done a taping method to address that. The second tape, like I mentioned earlier, is more of a structural support. This is to provide more stability medially, or in the inside part of the ankle where the injury has taken place.
And that's where all the muscles are attaching right there, right at the base of the foot?
Yeah.
So that's why you're just trying to anchor that down so it doesn't move around too much?
Yeah.
Okay.
So this one does not really involve any positional holds that's required of the patient. But more or less, I still will provide a little bit of pressure. And again, with this one, there's going to be an anchor. And I'm going to put the anchor right at the 5th metatarsal.
So that's the outside of the foot.
And I'm going to provide a stretch bit. I'm going to actively, as I provide the stretch, plant it down.
Okay.
So it's
what percentage are you pulling the tape, you say, on this one?
This one I might go up to 75%.
Okay, so a little bit more taut.
Yeah. So I'll just kind of reset the ankle back into neutral.
Okay.
From the 5th metatarsal head across the plantar fascia, up across the other side to the navicular region.
Okay.
So here we go. Plant, cross, anchor.
You want that pretty snug to keep everything.
So I'm going to just activate. You see how much more swifter I applied that?
Yeah.
Because this is a structural one.
Bone versus muscle, technically, right?
Yeah.
Okay.
So I want this to activate, get a little heat down, and you did not see it in the video, but I pre-cut it, and they usually come more or less like this. So I've also, in addition to pre-cutting, I've rounded out the corners here, so that when you apply it, it just kind of fills in more nicely.
Doesn't peel off.
Doesn't peel off as easily. It moves with you. Again, this is called Kinesio Tape, so it works best during movement to help facilitate or inhibit. So this is 2 of up to 4 tape jobs that you can do for someone who's severely sprained their ankle in this sort of situation where the ankle rolls inward and the anatomy and the inside part is at risk. There's another, just to mention, one other tape job you can do in a very acute setting, meaning the first 24 to 48 hours when there may be a little bit of swelling involved. You can put what's called a lymphatic drainage technique, and that involves more of a web-like band of tape across.
It helps to reduce swelling.
Exactly.
Okay. And then, so just, it's a great job there. So do you incorporate this, would you say, is it helping? Oh, that's more the lymphatic thing? Okay.
Yeah.
Perfect.
So this is, again, a pre-cut strip that I might start off out here.
And that would reduce the swelling.
Just kind of wrap it around where the swelling is.
Okay. Great. Now with your therapy, you probably don't use this with everybody, but do you find it necessary for people that want to continue activity and you would tape them up? Like, would you do it before your therapeutic session or after, or how would you kind of incorporate this tape, like just generally within your own practice?
That's a good question. The tape goes on pretty much within the first 20% of our session. So if the session was an hour long, within that first 10 to 15 minutes, I would have put the tape on just so that they can do the exercises with the tape on, with the extra support or the extra relief, if you can call inhibition relief. So more or less the beginning of the session.
Okay, great. And then how long would, let's say, she would keep this on for her ankle? How long does the tape last and its effectiveness?
Right. Depending on how dirty, how wet it gets, on average, it should last the patient or client 3 to 5 days of usage. Reapplication is pretty basic once instructed. So preferably you want to go to a professional or someone who's been trained at the specific tape to get it taped, but it can also be self-taught or self-instructed so that the client tapes him or herself. The tape comes in a little box like this, and I think some of the newer boxes even come with instructions for the take-home client. But for someone who is new or has no idea of taping, it's best to go seek someone professionally first.
Great. So if you're in the San Francisco area and you need some physical therapy done on ankles or anything else, come check out Jeff at his place in San Francisco off Brandon and Delancey. MoveWell Physical Therapy's website?
Yep, www.movewellphysicaltherapy.com.
All right, check him out, and thanks for your time, Jeff, and appreciate it.
Got it.